Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, and you're watching my YouTube channel. Today's informational video will be on colic in babies, and a disclaimer that this video is just for information, is not superior to a clinical exam by a qualified health provider. So don't hesitate to consult your child if you have any hesitate to consult your regular doctor if you have any concern for your child's health. So infantile colic is a very common subject. Colic means pain, infant means child, or colic means pain most likely related to the gastrointestinal tract. And during this colic, the children could be crying excessively up to 3 hours, more than 3 times per week, for over 3 weeks before you will say, okay, this is infantile colic or colic in babies, which is non-serious. It can happen in up to 25% or almost 1/3 of the babies. Usually it starts around 2 to 3 weeks of life, and the peak time is around 6 to 8 weeks. And usually the colic resolves in most babies up to age 4 months. It goes away, and most of the times it follows circadian rhythm. The peak hours are the evening hours when the parents are tired, they want to go to bed, but however the child starts crying. The child may clench the hands, feet, draw up the legs and start crying, which is prolonged, loud, high-pitched, and it is really annoying and worrisome for the parent. And it is a diagnosis of exclusion. That is a very important thing. Exact cause is really not known. Many possibility could be gastrointestinal, like I said earlier, could be neuropsychological causes, could be allergy to foods, could be parental misadventures. Parents are young, they don't know how to manage their babies. They are new parents. Could be lactose intolerance, like I said, or child is gassy, a pacifier is used and child is in a lot of gas is going in, or a bottle which is left and it empties. However, the baby continues to suck on it and the gas keeps on collecting in the intestines, and of course the baby is not able to pass that gas. Behavioral factors like feeding problems, infant position. Mom is not really sure how to breastfeed the baby. It's a new mom. She is tired herself. She doesn't know what is the best position to breastfeed the baby. So a lactation consult or an advice from a physician or nurse practitioner or a nurse who is lactation consultant would be really useful. How to position the head of the baby, what should be the posture of mom, and how long to breastfeed, and making sure the mom is hydrated, and a physical exam by their mom's OB can look at the anatomical variance of mom's breast nipples, making sure they're appropriate for the baby will be useful. Psychological factors: mom is depressed, anxiety, psychosocial problems, postpartum depression, new parenting skills, their lack of knowledge, their own stresses, being tired, a single caregiver with no support from the family could be a very big concern for maternal and infant interaction, and the baby crying excessively. Usually if the baby is brought to the physician, the vital signs including temperature, respiratory rate, blood pressure, oxygen saturation, they are all in good range. Temperature is also normal, so the baby has a normal physical exam, no signs of any infection, then you can say, like based on history, physical exam, the child appears well and it's likely colic. But again, it is a diagnosis of exclusion, and usually if you don't suspect anything serious and child is consolable, usually no lab tests are needed. Sometimes parents may be overfeeding the children because whenever they cry, they may think that the baby is hungry. It's only a matter of chance. It's possible that the child is uncomfortable because it's too hot or too cold. The child has a wet diaper that needs to be changed, or the child is being overstimulated, too many caregivers around, the child wants to take a nap, cannot sleep. That can be those problems. They could be given juice which is fermenting a lot of gas in the intestines, like undiluted fruit juices at a young age should not be given. The child is not being fed properly, is very hungry. There's too much excitement in the home because new baby is there, or there are frequent visitors that are affecting the sleep of the baby. So, and a lot of factors are still unknown that are causing the colic, and the reassurance that it will eventually go away in 3 to 4 months of age of the baby, and involving other social people, other caregivers to give breaks to the parents would be useful. Sometimes turning on music, turning on a washer or dryer, or just taking the baby for a walk if the weather is nice outside, or taking the child for a drive can break the spell of excessive crying. Make sure the baby is dressed appropriately, the baby is fed normally, there is no wet diaper, the baby is comfortable, temperature 100.4 degree Fahrenheit or higher is fever, so child is afebrile, is not breathing fast, is not looking blue or unresponsive. For a physician, looking at the mottling of the skin, blood pressure, oxygen saturation, they are important. Anterior fontanelle being bulging, corneal abrasion, hair tourniquet, increased work of breathing, abdominal distension, vomiting, any anal fissures. Excessive distension could be due to constipation. Making sure there is no bruise on the baby, there's no swelling of the joint, the child is not using all the extremities, moving all of them, neonatal reflexes, Morrow, cross extension, plantar, all those neonatal reflexes, sucking reflex, rooting reflex, they are all normal. Placebo medications are being used, simethicone drops are available over the counter, changing the formulas are done, lactose-free formula are used, addition of lactase in the formula, which are anecdotal, they may or may not be useful. Low allergen diets in mom, diet free of egg, milk, nuts, wheat, artificial colors or preservatives, again those are also being done. Herbal teas in mom, some reduction in the babies, those things are again specific to the population and specific to the geographic area. So the big things which should not be missed in it, before you label infantile colic is infections. Make sure there is no fever in the child, and lack of fever does not mean that the child does not have infection. So the bigger things, infection in the mouth, urinary tract infection, meningitis or encephalitis, joint arthritis, bone inflammation like osteomyelitis, especially if there's sickle cell disease, any non-accidental or accidental trauma, should not clavicular fracture, the baby falls from the changing table, testicular torsion, cardiac causes, missed ventricular septal defect is important, because it can lead to heart failure and fatigue during feeding, and that leads to fussiness and excessive crying, gastroesophageal reflux disease. Acidic contents go up the esophagus, causing irritation, which can cause Sandy Fair syndrome, which is arching of the back with reflux. Recent immunizations, insect bites, spider bites, eye corneal abrasions, glaucoma, prominence of the eyeball, surgical volvulus intussusception hernia. So volvulus is the movement of the intestine, coiling of intestines. Intussusception is the telescoping of intestine. Hernia is a bowel of intestine that gets obstructed in the inguinal canal with impairment of blood supply and leading to excessive pain and irritability. But it is a common clinical dilemma of diagnosing infantile colic and ruling out other pathologic causes. Every case has to be individualized. Detailed physical exam is important, and usually if the physical exam is normal, history is suggestive of colic, do not order any blood tests. Close follow-up is important. However, if the child is very sick looking, growth is impaired, then needs investigations or workup. And of course, the big is the non-accidental trauma or child abuse. And always, if everything is fine, reassurance and support for the parent is very, 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 very important. And close follow-up by the physician is very important. Support from the family, husband and wife is very important. Other caregivers, cousins, aunts, uncles, grandparents, their support is very important. And a good exam by the physician in 24 hours will be really useful to make sure that the child is doing well, is his or her vital signs are stable, is tolerating feeds, is peeing and pooping okay. So those are the big things which are reassuring and indicating that it's a simple colic, which is basically excessive crying in a child up to 3 hours or more, 3 times a week, and up to 3 weeks. And again, it can resolve in 3 to 4 months. So it's a rule of threes that could be remembered. I hope this informational video was useful for you all. Please like this video, give any comments. If you want me to talk on any other topic, I would be happy to do that. Take care of yourselves and families. May Allah help us all. Sallallahu alayhi wa alihi wa sahbihi wa sallimu taslima. Thank you.